Hi everyone, our group is presenting on how we can use components of the Netherlands healthcare system to improve the U.S. healthcare system. The political system in the Netherlands is a constitutional monarchy and parliamentary democracy. The Netherlands' gross domestic product was $913.7 billion in 2018, and an average of 10.5% of the total GDP is spent on healthcare each year. The culture in the country is diverse and reflects regional differences, and the population takes great pride in their cultural heritage. There is much room for improvement around social inclusion in the country, especially surrounding people who live below the poverty line and gender inequality. The Netherlands has universal health coverage, which essentially means that all residents are assured access to health care. The 2006 Health Insurance Act merged the traditional public and private insurance markets into one universal social health insurance program, underpinned by private insurance and mandatory coverage. All residents and non-residents who pay Dutch income tax must purchase statutory health insurance from private insurers. Adults choose a policy on an individual basis, and children under 18 are then automatically covered. Insurers are required to accept all applicants, and enrollees have the right to change their insurer each year. The uninsured are fined, and their insurance premiums may be levied directly from income. The national government has overall responsibility for setting healthcare priorities, introducing legislative changes when necessary, and monitoring access, quality, and costs in the country's market-based system. The Netherlands healthcare system is very similar to the United States Affordable Care Act. It is a system that requires everyone in the Netherlands to buy health insurance. Life expectancy is higher in the Netherlands, and they also provide cheaper flat-rate deductibles. Both countries use electronic health records and bundle payment methods. This slide presents additional similarities and differences between the two healthcare systems. Here is some additional information and specific breakdowns on similarities and differences between the U.S. and Netherlands healthcare systems. Two key problems in the U.S. healthcare system are that there is no central agency that governs the healthcare system, and there are no flat-rate deductibles for health insurance, with differences between insurance agencies and policies. A major problem in the U.S. healthcare system is the lack of a central agency. The lack of a central agency creates little standardization in an already fragmented system and leads to a complex and inefficient system. Since the U.S. primarily utilizes private financing, no central government agency governs the system, meaning there are no government-sponsored healthcare services available to all citizens. The government also does not play a role in monitoring costs and utilization of healthcare services. Multiple payers leads to an unmanageable system and inefficiencies due to overlapped health services. Due to there being no universal healthcare system in the U.S., a substantial amount of people are left uninsured. Specifically, 8% of people in the U.S. were left uninsured in 2019. Overall, this lack of a central agency leads to the U.S. not being able to deliver equitable healthcare services to every American. We can fix this issue by establishing a central agency to govern our healthcare system. The national government should hold overall responsibility for setting healthcare priorities and should monitor access, quality, and costs, similar to the role of the Netherlands national government. Government-sponsored healthcare services should be made available to all citizens through a system-wide allocation of resources. Implementing universal social health insurance by merging public and private insurance markets, similar to the Netherlands 2006 Health Insurance Act, would also be effective, as this creates a single-payer system with our government as our primary payer, removing our existing cumbersome system of multiple payers. The second problem of U.S. healthcare that we identified was that there are no flat-rate deductibles for health insurance, and that the differences between insurance agencies and insurance policies may cause issues for individuals. In the Netherlands, everyone must buy health insurance, and they all pay the same flat-rate deductible. The differences that exist within the U.S. create some problems. No flat-rate deductible in the U.S. leads to some individuals having difficulties in affording to pay their deductible, whether the cost is too high or the out-of-pocket cost to reach the deductible puts a financial burden on themselves and their family. These high deductibles lead to some not seeking health care. The differences between insurance agencies and policies is also problematic, as some providers and institutions do not take certain insurance agencies or plans, such as Medicare, and this may limit the amount of care or number of physicians that an individual may be able to see. Another problem is the high average cost per person of health insurance. Health insurance is very expensive, and for this reason, individuals may forego health insurance altogether, putting them at risk in the future. There are a few methods to decrease healthcare costs. First, a shift towards a managed competition system governed by a central agency is crucial to begin adapting affordable health care for all. The government can mandate basic health insurance coverage for the lower and middle class. The insured are then able to choose from a select choice of insurers every year by viewing their online profiles. This allows for insurers to freely market and innovate their services in order to attract consumers and practice in their own facilities. This drives competitive pricing while pushing for positive health incentives. The second solution is to create a risk equalization system that is funded by income taxes and federal subsidies. This is a crucial component of regulation for national healthcare insurance. It determines risk factors among individuals and pays insurers for caring for high-risk members. Its use is partially shown in the Medicare Advantage risk adjustment system. Overall, these solutions can lower healthcare costs and navigate the population towards healthy outcomes.